Hiatus or not, we can't just skip an HRT update video. That's like skipping leg day. Hello everyone, welcome back. My name is Maddie, and here on this channel we mostly make videos about LGBT issues and mental health, with the occasional off-topic video here and there. So I'm a trans woman, and I've been on feminizing hormones, also known as HRT or hormone replacement therapy, for 3 years as of March 26, 2022. And for the past 3 years, I've made it a habit to talk about our experiences, with the important caveat that I don't speak for other trans feminine folks, and I certainly don't speak for trans masculine folks. Around the time of my 1 year anniversary, I made a video about all of the physical, mental, and emotional changes I experienced, and then for my 2 year anniversary, my fiance and I did a live stream to celebrate the occasion. But now that I've reached the 3 year mark, I kind of find myself wondering, what exactly has changed since last year? And if we're being perfectly honest, the results are mixed. So on the one hand, my emotional well-being, better than it's ever been before. Research is still underway, but the science seems to suggest that male brains and female brains are different, and that trans people tend to have brains that more closely resemble the gender they identify as, not the gender they were assigned at birth. I'm a seminarian by trade, so I'll stay in my lane and not try to talk too much about science, but there are moments when communication drops between my doctors and my pharmacist, and I can't begin to tell you how much of a negative difference it makes in my life when I'm not on testosterone blockers and estrogen, especially the testosterone blockers. Like, if I have to go for a little bit without estrogen, it's not the end of the world if I still have the blockers. I'll feel a bit unwell, a bit moody, but I'll be fine. But without testosterone blockers, I literally don't feel like myself, and not in a oh, a switch just happened kind of way, but in a why is my body betraying me sort of way. I don't think it's an exaggeration to say that my hormone replacement therapy is just as important to my mental well-being as my lithium, and my lithium is the medication that literally helps me want to live. I'm definitely a human being that's meant to be powered on estrogen, not testosterone. Still, when we think of the changes that come with HRT, we often think of the physical changes that come with it. It's the reason why we love seeing trans timelines and before and after pics and transgender transformations in general. We often marvel at the radical difference that time and hormones can create. My transformation, however, has been much less radical than I had hoped for. Starting with the positives, I smell a lot better than I used to, at least in my personal opinion. I'm also really satisfied with the amount of breast development I've had, and my fiance frequently marvels at how soft my skin is now. And there's a certain confidence and reassurance that comes with knowing that my estrogen and testosterone levels are within traditional cis female ranges. Like, hormones are one of the biggest differences between men and women, and I can now say with certainty that the blood that flows through my veins affirms the reality of who I am, and that's so cool. All that being said, I'm less than thrilled with what HRT has done, or perhaps hasn't done, to my face. Back when I was trying to start HRT, one of my most common explanations for why I wanted hormones was something to the effect of, I want people to look at me and see a woman. I want to be able to walk around in public, no makeup, hair not done, dressed in ratty clothes, and still be gendered correctly. Not because people know me and they choose to be respectful, but because people just see a woman. Basically, I wanted to pass. Even if passing is a problematic concept for reasons that I might explain in a future video, it's what I wanted. Honestly, it's still what I want. And there are many things that contribute to how our gender is perceived: hair, voice, clothing, height, and so on. But a big part of how our gender is perceived is our face. And while you can definitely look at old pictures of me and see that we've changed, I'm not sure if we've even hit androgyny, let alone femininity. Makeup definitely helps. I can do some pretty incredible things with hair and makeup, but I want to get to a point where I don't have to spend an hour or so getting ready in the hopes that people will see me for who I am. Realistically, I know that facial feminization surgery, or FFS, is probably in my future, and on some level I'm okay with that. But I wish I'd known prior to starting HRT that my face wasn't going to change quite as much as I'd hoped for. Also, I wish I would have known the extent to which HRT can be a contributing factor for weight gain, because that has been a tough pill to swallow. To be perfectly clear, I knew that weight gain was a possibility. I did extensive research before embarking on this journey. I knew that fat would likely accumulate around my chest and my hips. But I was also under the impression that I would lose a ton of muscle mass, thus balancing it out. In my head, the worst case scenario was that I would stay the same weight I was when I started, Best case scenario would be losing weight. But no, between the hormones and the medications I take to keep my mental health in check, I've gained a significant amount of weight. My muscle mass hasn't decreased as much as I expected, and my fat accumulation has skyrocketed. And in response to gaining a significant amount of weight, I've also developed an eating disorder, which, I'm losing weight now, but not in the best ways. Not even close. I'm not going to get into the details of my eating disorder for a number of reasons. I don't want to glorify eating disorders. I don't want to give anyone ideas in case they're at risk of developing an eating disorder. And also, I'm still trying to make sense of the fact that I even have an eating disorder. It's really easy to play the comparison game and explain away my experiences by arguing that my eating disorder isn't nearly as bad as their eating disorder, but that line of thinking doesn't help me, and it doesn't help the hypothetical other person either. Someone I used to be friends with once reminded me that it's pretty awful to use someone else's suffering as an excuse not to get help for yourself, and I'm definitely inclined to agree with that. What I will say is that I've reached out for help. Believe me when I say that it's one of the hardest things I've ever done, but I did it. I started talking to a medical professional who's trained in helping people overcome their eating disorders, and honestly, I'm proud of that. Terrified, but proud. So if you're watching this and you're struggling to reach out for help with a problem that you're facing, let this be a sign that it's going to be okay. You can reach out for help. You deserve the support you long for, and we'll get through it together. I've gone off on a bit of a tangent, but I think it's an important thing to acknowledge. Not just that HRT can cause weight gain, but also that trans people can be highly susceptible to eating disorders, often as a result of gender dysphoria, but also for a host of other reasons as well. With all that being said, if I could go back 3 years ago and do it all over again, would I still pursue HRT? Absolutely. 100% without a doubt, yes. Like I mentioned towards the beginning of this video, I am meant to be an estrogen-powered being, just like some people are meant to be testosterone-powered beings. Also, while I focus on some of the more negative physical effects of HRT, the boobs are nice. The decreased facial hair growth and the softer skin and the decreased libido are all nice. With the exception of the weight gain, most of my complaints about HRT have to do with things I wish it did more of, not things I wish it didn't do. Still, as trans elders have a tendency to say, your mileage may vary. HRT affects everyone differently, especially since genetics play a massive role. So another trans woman could go on HRT and lose weight, see a complete facial transformation, and have almost no breast development, the exact opposite of me. And that's okay. Just like there's no one right way to transition, there's no one right way that HRT can work in your body. And on that note, there's no one right way to have a body. If you're like me, that can be a hard truth to accept, but that doesn't make it any less true. Bodies of all shapes and sizes are beautiful. Male, female, and intersex bodies are all amazing. Trans and cis bodies, both hella rad. And Haley Steinfeld is totally right in saying that it's okay if you want to change the body that you came in, but we shouldn't lose sight of the fact that it's incredible that our bodies can change. From hormones and surgeries to piercings and tattoos, we are all capable of incredible change. And I don't know about you, but I think that's wonderful. So yeah, HRT changed a lot for me. And also, there's a lot that HRT can't do. If you're a trans woman like me, HRT isn't going to change your voice. It probably isn't going to change how big your hands or your feet are, or how broad your shoulders might be. It might not change your face as much as you'd like, and it's probably not going to change how you feel about your reproductive organs, although between you and me, sex is vastly different post-HRT, so you might. Still, HRT has been an absolute game changer for me, and I'd recommend it to anyone, provided that they've taken the time to do their research and figure out whether or not HRT is right for them. But what about you? If you're on HRT, I'd love to hear about your experiences in the comments. And to be clear, I'm talking to people who have been on masculinizing hormones as well. This video focused on feminizing hormones because that's been my experience, but there's so much I don't know about the flip side. Also, if you have any questions about HRT, consider the comments to be a safe place to ask them. I can't promise that I'll have all the answers, but I can promise that I'll do my best to keep the comments a safe place. I have a pretty good track record of deleting hateful comments in record time. If you enjoyed this video, I'd really appreciate it if you could hit the like button and subscribe for more content just like this. But most importantly, remember that you're wonderful, and that the world is a better place because you're in it. And as always, thank you so much for watching, and I'll see you again in the next video. Bye!